Well, concern has been raised that too much focus has been placed on fighting coronavirus at the expense of other health conditions. Ahead of International Albinism Awareness Day, Amnesty International urges Southern African governments to ensure the protection and well-being of persons with albinism who are increasingly vulnerable amid the COVID-19 crisis. Well, lockdowns across the region have hindered access to healthcare facilities and skin cancer clinics, as well as vital sunscreen. Joining me now to discuss this is Tigere Chaguta, Amnesty International's Deputy Director for Southern Africa. Tigere, good afternoon to you and thank you so much for joining us.
Thank you. Thank you for inviting us. Good afternoon.
Sure. Amnesty International, you've raised concern about the increased risk of attack on people living with albinism, especially during the lockdown. Tell us more about that.
Thanks. So persons with albinism generally across sub-Saharan Africa live lives of fear. Over the last 15 years, we've documented around 600 attacks on persons with albinism, and in Southern Africa alone, 151 of those have resulted in deaths. So that's a travesty when you look at the fact that this is a group of people who are living in constant fear.
And how much more then has this been intensified during a lockdown, you know, when people living with albinism are now confined to their homes and to their communities?
So obviously, you know, with restrictions that have come in, it means that persons with albinism are generally now stuck in communities and in homes where they live in close quarters with their perpetrators, but do not have the ability to seek immediate assistance should they need to do so.
Yeah. And would you say governments, you know, across Southern Africa are mindful not to even further leave behind people living with albinism when it comes to the measures that have been put in place to curb the spread of the virus?
This hasn't shown up in government responses. So persons with albinism are generally left behind, be it in access to health, access to other basic amenities. And we've seen governments in the region coming up with a number of responses to this pandemic. Unfortunately, none of those have been specific to ensuring that persons with albinism continue to access these vital and essential services which they ought to access.
Well, tell us a bit about the work that Amnesty International has done during the lockdown. I mean, have you been able to find that people who are marginalized, you know, people living with albinism have had greater difficulties accessing things, like you said, like healthcare and those cancer clinics as well?
Yes, so generally we've seen that the pandemic has hit much harder on people who are marginalized. These are people who do not have the ability to stockpile food. These are people who do not have the ability to seek preventative treatments, for instance. And we have seen through our analysis since the pandemic reached this region that the marginalized have had their conditions further worsened during this time, essentially because they don't have the means to access any of the treatments. They don't have the means to access food. They don't have the means to access any basic amenities which others who are more well-to-do in communities have been able to do in this moment.
One of the things that Amnesty International has also raised is the issue of the social grants. I mean, you speak about countries like Malawi, where people living with albinism cannot necessarily access some of those poverty alleviation programs that are in place because of their condition. Would you say that's the case in South Africa as well?
Well, right across the region, we've seen that because, first of all, at a policy level, albinism is often not classified as a disability. So where governments have set aside specific measures for people that have disabilities, persons with albinism have not been able to access those. But also generally, at a practical level, persons with albinism, when they're exposed to the sun, this results in a lot of health impacts on them. but we have not seen specific measures being put in place to enable persons with albinism to go and seek food, to go and seek health and other services which they might, they might need at this moment in ways that do not expose them to further harm.
Sure. I mean, Tigera, should albinism be seen or declared, a disability, in your view?
Certainly. I mean, albinism is an inherited genetic condition which results in, the failure of the skin to produce melanin, which protects us from the sun. So in that way, the people are born with this. And as a result of that condition, they suffer from, skin cancer, they suffer from visual impairments. And therefore, there's no reason why albinism should not be declared and classified as a disability.
That's quite interesting. I mean, speak to us about the strides that have been made over the years to educate people. I mean, there's people who are watching right now who are hearing some of the information that you're putting out there for the very first time. When it comes to albinism, especially in our rural communities, there's still a lot of myths around, if you have the body or the remains of someone who's been living with albinism, you can get rich or you'll be prosperous. What sort of work has been done over the years to bust these myths and educate people?
So over the years, one would say, it's getting slightly better. I mean, when you look at the UN level now, we have an independent expert on the enjoyment of human rights by persons with albinism. In South Africa in 2013, with the Ekurhuleni Declaration on persons with albinism. And increasingly, we are seeing that there's more awareness, but nearly not enough. The fact that we are still having killings of persons with albinism clearly as a manifestation of deep-rooted erroneous cultural beliefs, is indicative of the fact that there's a lot that still needs to be done. There's still a lot of ignorance and there's still a lot of harmful beliefs that continue to proliferate in our communities.
Absolutely. And how then, together, do you as Amnesty International continue to send those messages out, even during the pandemic?
So we have been running a program now for years where we've been engaging with, albinism associations across the region. We've been engaging with policymakers, right from the national level to the SADC regional level, essentially making sure that, awareness is built, but also that we have robust policy interventions and criminal justice interventions to ensure that persons with albinism continue to enjoy their human rights. And during this time of the COVID pandemic, we have had to ramp up that work, essentially because vulnerability is heightened during this time.
Sure. I mean, just before we let you go, what's your final word or your message today as we mark World Albinism Awareness Day?
So the theme of this year's Albinism Awareness Day is Made to Shine. So, the first thing is to appeal to communities out there to celebrate the achievements of persons with albinism, to appeal to communities out there to change our behavior, to seek more education, but as well, to work for the enjoyment of human rights of persons with albinism as we do any other groups in our populations.